what is one thing every woman should know about their vaginal health that no one talks about?
I think one of the most important things is just the link between the vagina and the pelvic floor muscles is like the first thing that women need to know.
What are some common myths that you hear about vaginas that just like drive you absolutely crazy?
Some of the things are you don't need to use like a cleaning product on the vulva and vagina itself. It's really what I describe as a self-cleaning oven.
How do you know if your vagina is healthy? Like what happens when your vagina isn't healthy?
So there's two different things I would think about. And then one from a vaginal perspective, like healthy mucosal tissue. I always tell people the inside of the vagina is like the inside of your mouth. So if you feel like a canker sore inside your mouth, like if you feel like a soreness, a rawness, something sensitive, irritating on the inside of the vagina, that's an issue.
Welcome. We have Dr. Sara, a renowned pelvic floor physical therapist. We are so excited to have you here.
Thanks everyone for having me.
So today we're going to dive into all things pelvic floor health with everyone. And we want to pick your brain, Sara, about just overall vaginal health and the top things that we need to know. We have a lot of questions as women, and I feel like it's a topic that a lot of people are embarrassed to bring up and talk about. All right, I just want to take a quick moment to acknowledge one of our initial sponsors, that's In Beauty Project. They stepped up and offered to sponsor our first episode, which we're so excited about. Also, interestingly, we all use In Beauty Project, specifically their extreme cream. So we were so excited to see that they wanted to sponsor this episode. And as derms, we're always looking for the best skincare formula to recommend to our patients. But one of our most recent discoveries that delivers on efficacy, performance, and quality is the In Beauty Project Extreme Cream. So this is one of my go-to moisturizers. It's ideal for all skin types and ages, whether you're 25 or you're above the age of 65, because it has a superior formula packed with ingredients like peptides, ceramides, and bioretinol, which all help with lifting, firming, hydrating. These all have amazing benefits for the skin and is well tolerated by all skin types. It's clinically tested, it's hypoallergenic, it's non-comedogenic, meaning it won't break you out, and it's fragrance-free. And my favorite part is that it is just under $50, which is a steal for a product that can do all of these amazing things. It's truly one of the most high value products that we have come across to date. This is the type of daily care that your skin needs in between procedures and derm visits. And also, I am so grateful, but they gave us a code for 15% off. So exciting. So the code is Skin Deep. It's one word. You can use it at inbeautyproject.com. That gets you 15% off your first order of the extreme cream. And then you could click the link in the show notes as well if you want to also save 15% off your order. We just want to ask, what is one thing every woman should know about their vaginal health that no one talks about?
I love that we're even having a conversation and can just say the word vagina out here and just put it out there. So I think one of the things is we've heard a lot of buzz about pelvic floor health recently, and we don't even always associate that with the vagina. So the pelvic floor is a basket of muscles that sits at the base of your pelvis. And it has three openings, one for the urethra where urine exits, one for the anal opening where poop exits, and then the vagina for vaginal birth, vaginal intercourse, menstruation. And if you're having issues with what we consider, the vulva or vagina, then you may have burning with intercourse. You may have dryness, sensitivity, irritation, bladder or bowel issues, and there are muscles in the pelvic floor that can be associated with. So I think one of the most important things is just the link between the vagina and the pelvic floor muscles is like the first thing that women need to know.
I love that you're talking to us like we know nothing, because I know nothing, even though we're doctors. Like this is such a complicated, complex part of your body with muscles, like with names that we've never heard of. I mean, I was saying we learn these words in medical school, but it's so complicated that I just put it out of my mind because my little brain couldn't understand it. So thank you for breaking it down like so simply?
So one of the things is that I think that even in the medical field or, just a layperson, we don't talk about these things, yet we use
Mm.
these muscles so often throughout our day. I mean, every time we have a bowel movement or urinate or even breathe or move or exercise, and particularly during pregnancy, postpartum, and menopause, we go through so many changes in our pelvic floor. And so, to your point, even if you are in the medical field, it's like, oh, we maybe have heard of it, but we don't know that there are
Uh-huh.
muscles down there or how to know if there's an issue or even like how to address the issue if it arises.
I mean, you're so right. Because, like, even as dermatologists, we deal with like vaginal mucosal conditions, but this is like a new world out there for us, like what is happening. So, with that, what are some common myths that you hear about vaginas that just like drive you absolutely crazy?
Well, there's a lot. So I think, I'm always like, we need vaginas to be in the spotlight, which is great. But then I think with that comes this, it's a little bit of the focus can be on like wellness for the vagina when we actually want to think of health of the vagina. So
Hmm.
some of the things are you don't need to use like a cleaning product on the vulva and vagina itself. It's really what I describe as a self-cleaning oven. So there are natural bacteria in the vagina that help keep it healthy. They maintain a pH balance. They have bacteria that can help ward off infections. And when you are cleansing it with harsh soap or chemicals or douching, that actually can disrupt that vaginal microbiome. So I always say like water is best. Make sure that you're rinsing the area when you shower or bathe, and just with warm water is fine. If you want to use a cleanser, make sure that it's something that's pH balanced, that's non-irritating, alcohol, paraben, glycerin, slurry, all of those kind of like yucky chemicals. And these are things as dermatologists, we're like, hey, let's be thoughtful about what we put on our face. I'm like, hey, let's be thoughtful about what we put on our vulvas and vaginas because we also want to maintain the health of that in the long run.
Yeah, I love that. I mean, I definitely don't like wipes either. I don't recommend them to my patients because I feel
Mhm.
like it would be like a potential trigger for contact dermatitis.
For
And that's
sure.
something we see.
And then the other thing is like the
Yeah.
products that we're using. I mean, if we think about tampons or menstrual pads or incontinence liners, historically these have had bleaches or they have a lot of chemicals in their
Mhm.
products. And so I love that there's so much more awareness about like what are we putting on our skin? What are we putting close to our sensitive tissues in our bodies? Do we really need these things or do we want to kind of be more thoughtful about the ingredients we're looking for? So I mean, again, I love the awareness that this is bringing. Some of the things I would say I don't love, or like I don't love vaginal steaming or V steaming. It is,
What's vaginal
What? We
steaming? I've
actually
never heard of
that.
this. Like, what
Oh
are
my
people
gosh.
doing?
so literally it's, and people are like, oh, this is an old ancient, practice in Asia. And it's actually not. So it's
They
when
just made it up.
if you, right, it's kind of something that just became a little bit more popular, but it's when you sit over a bucket of steaming water and you can put different herbs in it or tinctures. And the steam is supposed to either cleanse the vulva and
Oh,
vagina to help with fertility, to help with menstruation. Right. I
Okay,
know.
so I've actually tried this
no.
because
And
I actually well, no, because after I had my daughter, I had terrible hemorrhoids, and went back to China with my daughter one year, and like I went to see a traditional Chinese medicine doctor, and they gave me these packs. I did it once. I was like, "This is the weirdest thing. I'm never doing again." But literally, it was like I was like, "What am I supposed to do with these?" He's like, "You put them in like boiling water, and you basically squat over a
This is
basin."
fascinating.
Yeah,
And
I
how
did
was
that.
it?
Well, I mean, I think it's just the fact that, like, I literally am, like, squatting and putting more pressure. I did it once, but it was just more, like, time consuming. I totally believe there is a place for traditional Chinese medicine. Obviously,
Totally.
there's a long history behind it, but, like, for me, it was just number 1, it's time consuming, and 2, it's just awkward having
but
to squat over this. Was it I'm trying to think back, like, I don't know if I got any sort of instant relief, but with these treatments, I think it's meant like you're supposed to do a long term to really get the benefits. But now that you've said that, I was like, I've totally did it for my anus,
I
not
kind of
for
want to try
vagina.
it. Well, and to your point, Jenny, it's a little bit of, I think that we're taking in the Western world, we're taking these practices out of context of like what
Mhm.
is meant to be. And typically in, an Asian culture, if there is like a sitting in period where you can like, it's whole health and wellness and
Mhm.
nutrition and nurturing versus
Yeah.
like put your vulva over a a pot of steaming water. And there's a case of like a case
Yes.
study on vulvar burning, and somebody got a
Yeah.
2nd-degree burn. And I'm like, okay, we need to
Yes.
just be a little thoughtful about how we're implementing these in the US.
I was going to say that sounds like a recipe for disaster. Someone does a 20-second TikTok like, "Hey, steam your vagina." And the next thing you know, everyone's going to the emergency room with 2nd, 3rd-degree burns on their vulva. Like this, you if you're going to do it, you need to speak to someone who's who's
Yeah.
been recommending and doing it, and who is a professional, and to make sure that you don't put your vagina in danger.
Yeah.
Right, right. And also that it's in context of like have realistic expectations. Like
Right.
For
it's
sure.
likely not going to help with fertility. It may
No.
help with warming and soothing and relaxation, but it's not going to like give your vagina magical powers.
100%. Yeah.
Okay, Dr. Sarah, I have a crazy question. And I know the answer, but I think people are asking this all the time is pubic hair. Is it unhygienic to have it? I'm seeing people online saying that pubic hair is either good or bad for you. Like, settle the debate for us.
So it's I love that pubic hair is a point of debate now. So this is the wild world of social media. So it's actually, I mean, everything is there for a reason in our bodies, and it's typically to help ward off bacteria, prevent bacteria to getting into the vulva and vagina, as we mentioned, have a particular pH balance instead of bacteria that help ward off infections. And the pubic hair is there for another layer of protection. Now, if you want to trim your hair, wax your hair, shave your hair, there are all of these options that you can do. But what I would say is that if you are at a higher risk for infection, it may be something where you want to minimize how much like tending to the area you're doing. So avoiding hot waxes on the area, avoiding lasers, avoiding chemicals with shaving cream and things like that that could lead to folliculitis or irritation or, burning. So, but it's like a whatever works for you as long as it doesn't present any issues, but it is there biologically for a reason. But just like we have underarm hair and
Uh-huh.
leg hair, if you want to get rid of it, like that's fine, but just use kind of cleaner practices. And when you're use a clean razor and shave in the direction down of the pubic hair, make sure that it's a hygienic spa you're going to if you're going to get removal, things like that. So it's to each his own, but I see everything in my clinic. Like it is like, you know, everything down to the middle of the thighs to like, an older woman with like a landing strip. Like it is just
I
all
love
lots
that.
now. So it's whatever works for you and your body.
I love that. Yeah, I think that as dermatologists, we kind of see that as well. And I just like a PSA for people who are going to your dermatologist. Do not be embarrassed about what your vagina or that area looks like, because we see all walks of life too. Like, I'm trying to look through that. I don't care if your vagina's not shaved. I don't care if your legs aren't shaved. I do care if you have nail polish on, because I can't see through that. So, like, do not care what your medical professional or provider is thinking about you. We're only there to care about your health.
Totally. I
Yeah.
totally agree with that.
Yeah, but we
Yeah.
also, I don't know about you, Jenny and Mamina, but online people are blown away, like Dr. Sarah had said, that people are to shave not against the grain of the hair follicle. People don't realize that if you're experiencing razor bumps and issues and burning, like, there's so many practices you need to do to shave appropriately. Do you guys see that a lot?
Mm-hmm. Yeah.
Definitely.
And I actually
Yeah.
see a lot of the like pseudofolliculitis barbae in my skin and color patients in the private area. And it's
Yeah.
very frustrating because like they're permanent bump scars.
Yeah.
Yeah. And
Really
Mamina,
great.
go ahead. Mamina,
Yeah.
I saw you post something the other day about like just exfoliating the area too, if
yeah,
you're
like
gonna kind of shave.
how to prevent razor burns. Yeah, I think
Mhm.
that it's so important to shave with the grayness. It's something that we don't talk about. I think like just genital skin is something that is not talked about enough, just because I feel like it's sort of like an orphan area, because like derms sometimes like relay it to the OBs or the pelvic PTs, and like they're and a lot of the practitioners in those fields will like relate it back to derms. But so I think we should like continue to talk about this. But yes, with exfoliation and razor bumps, it's such a huge topic. And I think that it's so important to make sure that the skin is prepped prior to shaving, like making sure that you're using exfoliating products. And in terms of what products to use, everyone's different because everyone has different skin types. There's like mild exfoliants and like aggressive exfoliants. I'm a big fan of like sort of glycolic acid and salicylic acid exfoliating peel pads to use down there. And also, okay, so this was a tip And I don't know if any of you all came across this, but to soften the hair, to use conditioner so that it's not like an extra resistant barrier when you're shaving. So using conditioner, making sure that's washed off completely too, because conditioner can, depending on the person, could potentially also, irritate or clog pores as well. But that's just like a little random side tip that I found to be helpful too with
Love it.
patients.
Conditioning our pubic hairs. I love
Exactly.
this.
Yeah. So are we doing the full shampoo and conditioner
This is like a new
for
skincare
bushes
Yeah.
now?
Yeah.
Like literally
Yeah.
the everything shower. Yes.
Yeah. I have recommended patients are like, oh, I don't like buy shaving creams. What are alternatives? And I actually recommend using conditioners as like a sub for like shaving cream can help. So
Yeah.
that's a neat, yeah.
All right. Just wanted to take a moment to acknowledge one of our sponsors. They were one of the first sponsors to jump on board and support our show, and we are so grateful for them. And it is In Beauty Project. So, as dermatologists, we are always looking for the best skincare formulas to recommend to our patients. And one of our most recent discoveries that delivers on efficacy, performance, and quality is In Beauty Project's Extreme Cream. I'm holding it up here for people who are able to look at the video. This is one of my go-to daily moisturizers. It's ideal for all skin types and ages, whether our patients are 25 or 65 plus. It has a superior formula packed with ingredients like peptides, ceramides, and bioretinol for lifting, firming, and deep hydration benefits to the skin. And it's clinically tested, hypoallergenic, non-comedogenic, meaning it won't break you out, and it's fragrance-free. Plus, at just under $50, it's truly one of the most high-value products we have come across to date. This is the type of daily care that your skin needs in between procedures and derm visits. In Beauty Project clinically tests each final formula, proving that their skincare products are the most high-performing on the market and deliver the results they claim. This is very important for us. And In Beauty Project pairs uncompromising innovation and formulas, delivering high-performance skincare solutions for great skin days at any age. Remember to use the code SKINDEEP at inbeautyproject.com to receive 15% off your first order of Extreme Cream, or click the link in the show notes to save 15% off your order.
Okay, so I have another question. How do you know if your vagina is healthy? Like, what happens when your vagina isn't healthy? What are like some red flags?
So we're talking a little bit. So when we think of the vagina is a muscular canal that the opening is kind of what we see at the external portion of the pelvic floor, where we would insert a tampon or insert something into the vagina, like a speculum, penis, dildo. But the muscular canal is muscle, which is part of the pelvic floor complex. So there's two different things I would think about. And then one, from a vaginal perspective, like healthy mucosal tissue, I always tell people the inside of the vagina is like the inside of your mouth. So if you feel like a canker sore inside your mouth, like if you feel like a soreness, a rawness, something sensitive, irritating on the inside of the vagina, that's an issue I would tend to. I would go check in with your gynecologist. If you have vaginal dryness, so we go through different cycles monthly where every month actually where our estrogen surges right around ovulation, it dips back down, then you go through a slight surge again right before menstruation. When you go through those surges, you're going to have more discharge. So it's going to look like egg whitey, kind of like goopier discharge. And then you'll have some lighter, clumpier discharge when you get closer to your period. But if between those you have extreme vaginal dryness where it's like Sahara desert dry, it can feel itchy, it can feel raw, it feels like your labia are stuck together. It can be like your underwear sticks to your labia. Like that is a not normal symptom. So you want to have enough natural lubrication, even outside of ovulation or arousal, where it should feel like the inside of your mouth, like there's moisture there. Pain with sex is another one or pelvic examinations or tampon insertion where it can either feel like you're hitting a wall and that can be muscular, if you can't get something past the opening. It can feel painful with deeper insertion, like your partner is hitting something or it's tender or bruisey, and that's a more muscular issue. Or there can also be dryness and rawness, even some mild bleeding that would be a sign of potentially low estrogen or some dermatological conditions like lichen sclerosis or lichen planus. So I actually tell people to like look at your vulva once a month, like get a mirror because we don't even know what's going on down there. And if you don't know what your normal is, you can't know what your abnormal is. Like the color should be pink on inside the labia. You have two sets of labia. Sometimes labia can start to resorb, and that's a sign of like lower estrogen or a dermatological condition. So like look at your labia, look at your clitoris. Can you pull the hood back and see it? Can you, like open up the labia and see what your like urethral opening, vaginal opening look like? Like just know what your normal is so that you know what your like abnormal would be.
I
Okay, wait. I love that you brought up the mirror thing because I feel like so many people haven't even done that once. Like, I don't think I've done that like until I was an adult, and I was like, "Oh my God." I had no idea that that's what that looked like.
Right, right.
So anyways, I'm just so glad you brought that up.
Yeah, and also something I want to comment on, and I want you to talk more about this, is amongst my friend group, okay, we have this joke where we talk about our labia and our vagina, and we say, are you a gibbler or are you a puffy? And so I don't think a lot of
Tell
people
me
realize.
more.
Yeah, so I don't think people realize that like your labia can look all sorts of things. So what we joke as, again, these are non-medical people, and we think it's really funny. That to compare our vaginas is, a gibbler is when it kind of looks like a turkey neck. Your inner labia, your labia minora, kind of comes through more than your outer labia majora. And then a puffer is when your lips, your labia majora, is bigger. So could you talk a little bit more about the physical attributes of your vagina, your labia, your vulva, and like what that
Totally.
means?
So the vulva is like the whole external portion. That includes your mons pubis, where pubic hair is, your labia majora externally. So the labia majora are the ones with hair on them. They're kind of the bigger, puffier ones that you're talking about in the puffers. And then the labia minora are the thinner inner lips, which are hairless. And again, these are like layers of protection. Think of it like peeling layers of an onion. Like there's just more layers there. And so, but labia, it's like feet, or it's like you have different sizes, different shapes, different widths, different textures. It's different colors. So there is like no quote unquote normal. Some people have like one side is larger than the other. Sometimes people do have like a thinner labia minora internally, but kind of like larger labia majora. So it totally varies. And it's one of those things that, again, I think that when you see different types, which we don't see each other's vulvas, like I don't know what I mean, I know what my patients look like, but so you don't know kind of what's normal for you and what's normal for other people, but there are all walks. And the only thing as I would say is there are cases where it's bothersome for people. So people have larger labia and it's like irritating. They can't work out, they can't wear pants. And that's something where I'm like, okay, you can get it addressed surgically. It's not common that that's necessary, but it's more functional. I don't want people to think that they need like a cosmetic procedure for their vulva or vagina. It's much more functional if it's causing you pain or irritation.
All vaginas are beautiful, right?
Yeah, and they have like amazing functions. I mean, the pelvic floor, it's like literally helps us hold in pee, and then when we sit down, the muscles relax to empty. Vaginas, it's like our pelvic floor muscles support growing babies during pregnancy, and then relax for a vaginal birth, or it's what we. Every month, if we have a menstrual cycle, it's like your vagina has to be relaxed and all of these things. So it's like we use this all throughout our day and our life. And that's why I'm always so cautious about, like, I don't want people to think it's like gross or icky, or it's like a part of our body, like an elbow. It's like I don't look at my elbow like that's an ugly elbow. Like that's got a lot of skin fold on that elbow. It's like it's just an elbow. It's just a body part, right? But it's very functional. And if we think about it that way, I think it kind of demystifies it and destigmatizes it.
Oh, I've had some patients disappointed in their elbow, but you're right. Like we shouldn't
I
be
shouldn't. I
disappointed.
should pick another body part then.
Yeah.
Oh my gosh.
Oh my God, this is so great. Yeah, well, so I know like you specialize so much in pelvic floor, and it's such an important topic. It's something we were talking about earlier, how it's like so neglected and not something that, that I don't think there's enough awareness. Like I am so grateful for your platform that I think that so many people, I mean, I think because of your platform, that's why I decided to go see a pelvic floor therapist. Well, it's so funny. Actually, it was Rob's idea because he follows you too. And he is the one who like really encouraged me. And I'm like, I know I should. So yeah, like want to dive deep more into pelvic floor territory and want to hear your thoughts. Like I know we talked about some myths that you hear just about vaginas in general, but when it comes to like pelvic floor issues, whether it comes to incontinence or anything, what are some like huge myths or misconceptions that you hear about?
Yeah, I think one of the biggest ones, Mamina, is that only pregnant or postpartum people are going to have pelvic floor issues. So, and that's
Mhm.
just not the case. I mean, there are studies that show that like 47% of female athletes who have never been pregnant experience incontinence. And if we think
Wow.
about that, it's like cheerleaders, runners, long distance runners, track stars, gymnasts, basketball players, tennis players. So we're seeing, I mean, I was watching the Olympics and I'm like, oh my God, these people's pelvic floors, and I'm like,
Mhm.
they need a pelvic floor therapist at the Olympics because it's so many different activities can contribute to it.
Mhm.
And I always say it's like if you're a runner and you have a knee injury or a sprain, like you can get that tended to. But when there's a pelvic floor issue that arises, especially if you've never been pregnant or postpartum, we aren't even like introduced to this part of our body. And then we start just dealing with it and we think, oh, maybe it'll get better, or maybe it'll go away, or maybe I'll just wear a different color leggings. And
Mhm.
Mhm.
so, but I want to kind of bring awareness to like people of all ages and stages can experience pelvic floor issues. So I want folks to be on the lookout. It can be a young woman who's hitting puberty and she has pain with tampon insertion. So again, if you feel like you're hitting a wall when you're trying to insert a tampon, if you have pain with gynecological exams, these can be uncomfortable, but they shouldn't be painful. The same thing goes with painful intercourse. Oftentimes, people had pain the first time they attempt intercourse, but if that persists, that is not a normal function or relaxation of the pelvic floor muscles. They should be able to relax. They should be well lubricated. You shouldn't have pain or discomfort during sex. It should be pleasurable and not just like tolerable or painful. And then we definitely know that, the three biggest risk factors for pelvic floor dysfunction are pregnancy, birth, and menopause.
Mhm.
And we know pregnancy, I compare the pelvic floor to like a hammock. And if it's a hammock that's supporting a growing baby, the heavier that baby gets, the more the hammock sinks down and starts to stretch out. And that's why pregnant women typically have urinary leakage or prolapse where the muscles aren't as supportive to the organs. And then birth, obviously, with a vaginal birth, there's just pushing and tearing that can occur as well.
Yeah.
That's so interesting. So with that, do you recommend that we kind of preventatively exercise our pelvic floor or only when like we have symptoms?
Ugh, always beforehand. It's kind of like for y'all, if it's like, oh, only start wearing sunscreen like after you get the
Right?
skin cancer
Yeah.
treated.
Mhm.
But like, no, we always have to like be on the proactive preventative side.
Yeah.
And I think this is my challenge with like the current medical system and how we care for the pelvic floor is like it's always like an afterthought. It's a little bit of damage control. It's like, oh, now she's got prolapse. Like maybe she needs surgery or maybe let's just do a trial of physical therapy first. Like if
Yeah.
we can really educate people sooner and during these times when their pelvic floor is vulnerable, like pregnancy and preparing for birth and then postpartum, I think we can prevent a lot of these pelvic floor issues down the line. Because then once we hit menopause and we don't have this hormonal system of estrogen and testosterone and collagen to build up that tissue and muscle, and you've already got some pelvic floor dysfunction, then we're really kind of swimming upstream and it's much harder to get ahead of managing the symptoms.
So is there like a time where you recommend, people start doing exercises like in their teens, 20s? Like when is a good time to start thinking about
So
this?
it's such a great question. So I think if you are an avid exerciser, kind of knowing how to activate your pelvic floor during exercise. So we think about this a lot when we talk about our core muscles. We're like draw that belly button in or kind of engage your core, suck in, the belly button to the spine. Well, that's focusing on the abdominals, but at the base of your pelvis is the pelvic floor muscles. And so you want to lift and squeeze those up with exercise as well. So I always tell people think about like sipping up a thick smoothie with your vagina. It's like a sip up, and that pulls in your pelvic floor so that when you're lifting weights or lifting kids or want to work on just pelvic floor training, you kind of know what that activation feels like. It's what most people call a Kegel exercise. But then to your point, absolutely during pregnancy, I would proactively see a pelvic floor therapist. If you've had kids, it's like running a marathon for 9 months and then it's like a multi-day sprint at the end and then you have a baby to take care of after that. So working, training your body to maintain strength, navigate the changes, and then prepare for birth, I think are hugely important. And then seeing a pelvic floor therapist after birth as well, regardless of what type of birth you have.
So what's the deal with Kegels? Like, should we all be sitting here doing Kegel exercises all day, every day as we speak? Like, what should we be doing?
So, Kegels are pelvic floor contractions, like we talked about, that kind of sipping up the smoothie contraction. But it's not the only exercise you should do for your pelvic floor, and it's not the right exercise for everyone. So, like
What?
any,
Really?
yes, girl.
I
So with
didn't know that.
we're busting myths here.
Yes. What's the tea?
So just like every other muscle in your body, you can have weakness. And this is where strengthening or Kegel contractions and building that Kegel into exercise can be helpful. However, a lot of people have tension. So, like, I get a lot of tension in my head and neck, and then I get headaches. Well, if I'm like tightening all those muscles that are contributing to headaches, I'm just going to make that problem worse.
Oh my gosh.
So,
Wow.
oftentimes people with um, painful sex or incomplete bladder emptying or painful menstruation or urinary frequency or constipation, they have tension. And so those are folks who I'm like, don't do Kegels. You need
Oh
to
my
learn
gosh.
to relax the muscles with massage or stretching or breathing, and then you can strengthen if there's weakness. So there's two different pathways, and if we just send everybody home to do their Kegels, it's like, one, they probably not even going to be doing them properly, and two, they may not need them, and it could actually make their symptoms worse.
Oh my gosh. That's crazy.
I
Yeah,
know.
and
And I talk about this in my book. I have a whole chapter on like how to know which vagina you have. Like, is your
I love
vagina
that.
need
Yeah,
relaxation or strengthening?
can you tell us a
Yeah.
little bit about your book? I'm so excited that it's coming out.
Hi, can we just stop for a moment? I wanted to talk about something that's personal to me. So, I've been dealing with hair loss on and off for the last 20 years. And after I had my baby about a year and a half ago, I also experienced postpartum hair loss. And there is a device that has truly helped me. They are also sponsoring this episode, so we're so grateful for them. This is iRestore, and they have the Elite helmet. It's called the Elite, and it's their red light therapy helmet. So, red light therapy has been shown to be effective for hair regrowth. And what I like in particular about the Elite is that it has both LED and laser technology. So, you're getting both broad coverage as well as really good penetration into the hair follicle. So, I'm holding it up to the camera because this is what it looks like. It kind of looks like a bike helmet. I'm going to turn it on and I'm going to put it on. It goes on really easily and it fits pretty well. It's comfortable. And what I really also appreciate is that in a 4-month double-blind clinical study performed by a board-certified dermatologist, 100% of study participants grew more hair with iRestore's laser and LED technology. So you can feel confident knowing that you're buying a system with proven results. I would give yourself the gift of hair confidence this spring. For a limited time only, our listeners will get $625 off their iRestore Elite when you use code Skin Deep at irestorelaser.com. That's $625 off your iRestore Elite at irestorelaser.com with promo code Skin Deep. Please support our show and tell them that we sent you. Hair loss is frustrating. I get it, but you do not have to fight this alone thanks to iRestore.
Oh goodness, I am so excited as well because it was such a huge project to write. And one of the reasons I wanted to just put everything down on paper is that right now most of my content lives on social media, and I do have an online exercise platform for folks to do exercises and training as well for relaxation or strengthening. But I think these days folks want to get medical information in different ways. It could be an online program, it could be a book, it could be videos, and there were no pelvic floor books out there. I mean, there are dozens of books on hundreds on yoga and meditation and nutrition. And when you go to look for a pelvic floor book, there's just not like a guide that people can really go to like they can for menopause or their period. So I really just kind of poured everything that I had from my 17 years of experience in this field. And the book is called Floored. The complete guide for women's pelvic floor health at every age and stage. And it walks through periods and sex and pregnancy and postpartum and peeing and pooping problems and then menopause so that every woman can pick up this book and learn something about their body and how to take care of it.
There really isn't that many books on pelvic health. Like, that is mind blowing to me.
I
I feel
know.
disrespected as a woman.
Well,
Like,
I mean, that's why we're here, Lindsay, right? Because it's like
yes.
we want to learn more about our bodies. And people often ask me, like, how did you get into this field? And I started learning about this in physical therapy school with just a couple of lectures. And I was like, wow, I really love learning about my body. And then when you start working with patients to help them understand their bodies and to also help them with really intimate issues that were affecting their quality of life and their self esteem and have them overcome those has just been so rewarding. I mean, it's just been awesome. And so to be able to have this platform and to help women, across their lifespan with their pelvic floor health is just awesome. Like, none of us want to end up in diapers down the line. So, like, how can we start, like, preventing that now?
So you mentioned massage, and I will go back and say I have seen a pelvic floor therapist, but unfortunately, where I live, I had to do it virtually. So it was a friend that I went to high school with. She is now focuses on pelvic floor, so I did it virtually with her, and she was telling me I needed all these things that again blew my mind. She's like, you need to sit down, reach your hand up your like up into your pelvic floor and massage, and she sent me this tool to buy on Amazon where you massage it. And I was like, I told my husband, he's like, is that masturbation? Like, I'm confused. And
Yeah.
everyone was just confused, but I did it and it made such a difference. My pelvic muscles were so tight. It was like, it was mind blowing to me. And I just think, let's demystify that a little bit. Tell me about this pelvic floor massage, because I don't want people to be as shocked as I was when she told me to do this.
Totally. And so, kind of back to our previous conversation about, some people need relaxation. And so that would be a situation where, like, okay, Lindsay, don't do Kegels. That's going to make your issue worse. You do need to work on relaxing these pelvic floor muscles. It starts with breathing. It starts with kind of really learning how to do diaphragmatic breathing, which relaxes your pelvic floor. Stretches that help also relax your pelvic floor, like a child's pose or a deep squat or a happy baby pose, anything that kind of puts you into the squatting position. And then also just looking at how we're moving during the day. Are you like a butt clencher? We see these patients where I pull their gown open in the back and their like glutes are all tight and tense. They're like, I've got tailbone pain and I don't know why. I'm like, well, let's talk about how we're sitting. We all sit for a long time. We're all stressed and driving and clenching our tush. So looking at the day-to-day practices, but doing internal, so intravaginal or intrarectal, but mostly intravaginal massage is just going in and using a tool, or as a therapist, I use my index finger and just pressing on a muscle that's tight or tense. And then you breathe, you can move your hip in different directions or positions to help the muscle relax. It's just like when I go get a massage and I get them to work on my neck muscles because I've got knots in my neck and it's really tight and it helps with my headache. It's the same thing. The tools can look a little bit racy, but I assure you and your husband are medical devices. They legit are medical devices.
Sure.
Yeah, sure.
No, they
No, they
are
are.
the vibrating
Yeah.
one, and I was like, interesting. But whatever you want to do, use your FSA dollars. But
Yeah.
it really can. It's so simple. It's literally just muscles, just like
Wow.
I massage the muscles in my neck. It's the same thing for your pelvic floor, and that's really the beauty of it. Is it feels complex, but it's really so simple.
So
Something
fascinating.
I found fascinating. So I have the amazing privilege of being a patient of Sarah's, and you have definitely gone in there and massaged my pelvic floor, and it is the best. But something that, like I said, like
Wow,
she
the
I'm
puts,
best.
honored.
Okay.
yeah, she puts my vagina in a hypnotic state. But something that I also found interesting is how connected, and you were saying earlier about our abdominal muscles, about how connected like all of our surrounding muscles are, like our hip flexors, because you also do work on like my glutes and like other hip flexor muscles. And yeah, can you just elaborate that on a little bit? That's something I never knew about.
Totally. So I'm glad to hear that my vagina massages are the best.
I might
Highly
need to take a
recommend.
trip. I might need to
Look
take a
one
trip
there.
down to New Orleans to
Yeah.
get a
Like
hypnotic
such a-
vaginal massage.
Yeah,
Such a
5 stars
great
on
review.
Google.
So, this goes back to the peeling layers of the onion. Your pelvic floor is really so connected. So 36 different muscles connect to your pelvic bones. Your pelvic floor is part of that. But you have your abdominal wall muscles, your glute muscles, your back muscles, your inner and outer thigh muscles. So when you have tension internally, it can be also due to or influence the outside muscles. So, if somebody like has a really tight core, they suck in all the time, like that can cause a lot of abdominal tension and also cause pelvic floor tension. If we have a butt clencher who has like terrible sitting posture and just tenses all the time, that glute tension in their buttocks can also cause inner pelvic floor tension. Same thing with the hip flexors or the low back. So, I mean, we had people coming in with low back pain, and it could be due to pelvic organ prolapse or pelvic, floor muscle tension. So, there's so much connected. So, when you see a pelvic floor therapist or when you work on your pelvic floor, it's really working on the entire pelvic girdle. That's why these other stretches and postural changes are so important. And I also think that, like, if you're not ready to go stick this wand inside your vagina and massage the muscles out, you can start externally. Like, get a tennis ball and put it against the wall and like massage your glutes. Do a little abdominal massage or trigger point massage. Do some yoga and stretching. So there are different things that you can do to really start peeling those outer layers of the onion to help the internal layers relax as well.
So interesting.
Nice. So aside from the massager tool, are there other like gadgets that you've seen on social media that's like you think it's actually worth it or like totally avoid? Love to hear your take on that.
A little bit of both. So there's always like, oh, could be helpful for folks, or other ones that are like, this is like totally bogus. Don't do it. It's going to be a waste of your resources. So um, when it comes to things that I do like, there are some internal vaginal weights that you can use. It's literally looks like a tampon, but they have different size weights. And for some folks who want to have a little bit more resistance to their exercises, their pelvic floor training, or it helps them to have something to squeeze around. They're like, I can't feel if I'm doing a Kegel right. Inserting this weight and then having them use that in sitting and then sit to stand and then doing little mini squats. It's like lifting weights, but for your vag. And then you could increase the amount of intensity that you need. And there are also Kegel exercisers, which are like Bluetooth devices that you can insert into the vagina, and they look like larger tampons. And then it connects to like an app on your phone. And as you do Kegel contractions, it shows you on your phone how well you're contracting. So I think for folks who like can't connect, those are great devices to start with. Eventually, though, you want to bring this into your workouts, your Pilates, your bar, your HIIT workouts, your lifting your kids, lifting your Costco groceries, like learning how to use the muscle functionally. It's what's going to help you in the long run versus just like sitting on your bed doing Kegels with the device in. So it's a great first step. The things I don't love, there's a little bit of, y'all see a lot of red light therapy in, your derm practices. There is red light therapy for the vagina as well. The research is still out. I think the challenge with it is that it can be helpful, but the results are not long lasting. So it can help jumpstart kind of thickening the tissue and building up some collagen and muscle tone, but you still have to learn how to actively use these muscles. There are these vibrating chairs that people can sit on. They're like, you can do 30,000 Kegels in 30 minutes. I'm like, well, you don't need to do 30,000 Kegels in 30 minutes. You can just do 30. But again, we have to train people how to use this muscle. We can't just like stim it a ton and then send them on their way. Like, it's got to be real training that they can utilize lifelong.
I want to know more about the red light therapy because we
Yeah.
do use it in derm all of the time. And it is such a hot topic issue. And we use it as derms on our skin every single day. So like, how do I just like spread my legs and put my red light mask underneath here
you
and
can
turn it
try
on?
Yeah.
What do we need to know? Because people are going to do that if you don't tell us what to do.
Most often these are in gynecology offices or urogyn practices where they can have the device and they can use it on the vulva and vagina. And there's just been a handful, like very small clinical trials. The biggest thing is it can be effective in the 3 to 6 month time frame, but the long-term effects have not been studied. So again, if you have something at home where you can do this every day, it can be effective, but they don't have these devices available for home use. And there's no FDA clearance for that yet. And it's you have to be willing to kind of do that long term. The great thing about these red light masks are that like you can lay in your bed and do them and kind of even whatever. With the vulva and vagina, it just takes a little bit more like dedication and time. Like you got to really clear out some space and get some privacy and like, do the whole bit in your bed and you can't move. So but there are some PT practices that use it. There's urogyn offices, but there's not a lot of options for home use. But I tell people like, you do this, but you just have to also know that you have to do other stuff. You still have to know how to engage the muscles, relax the muscles, that kind of stuff.
Know your limitations, essentially.
Yeah.
Yeah, let's be realistic about it.
I actually personally used red light when I was postpartum, like in the first 2 weeks. I was so sore and I was desperate because I was like, I don't even know what to do. And I have a red light box that was given to me from a brand, Lumi. And I was like, I'm just going to try this. Like, I didn't even know it was something that could be utilized on there, but it's red light helps with wound healing. So I would just like hold the box down there and I think it helps, but that's just N of one. So, don't go everyone buying red light boxes, but
No, but this is good
you
to
know,
know.
Yeah.
It's good to know.
yeah,
And I
it
think
was
it's one of the
helpful.
things that if we know it could be for wound healing, that could be
Mhm.
helpful. If we know it could be for certain types of symptoms, whether it's, prolapse or incontinence or,
And like
you
soreness,
know,
like joint
fragile.
pain.
Right. So
Yeah.
I think we just need more information on how to do it.
Mhm.
It's one of those things though, Mamina, that I think it's like, it still kind of falls into this like wellness thing. And I think I'm always so
Yeah.
focused on function, like healing,
Uh-huh.
like minimizing pain and improving muscle tone that I just am like, I want to, always tell people like, hey, if you're going to go spend the money on this, I want to make sure it's going to be effective for
Oh,
you.
Yeah, no, totally,
100%.
totally get it. I feel like it's very much the same for derm too, because like, devices we use, we recommend, but like we always say, like, don't rely on this as your only like, and don't expect miracles. Like you have to have a good skincare routine, right? You gotta wear your sunscreen and then
Right.
maybe use your retinol. And then like if you've kind of maximized that and want to elevate, then I
Uh-huh.
think that like the masks would be helpful. So it
Yeah.
sounds
So
like
we need a
very
vulva
similar.
mask. We need
Yeah, there
like
you
this
go.
red
Somebody
light
needs to come up with
vulva
that.
So
mask.
is there does it only help externally? There is no internal type of red light treatment that you could use, as you had mentioned, like a tampon that you insert to more directly affect the pelvic floor. Does that exist?
Yeah, there are. There are laser wands, and that's what's
Wow.
available in, I think, Urogyne or Gyne offices
Wow.
or urology offices where it's a wand that you can insert. Years ago, this was like a laser therapy, like it was called the Mona Lisa, and there's been different
Oh,
things that have come out, and
yeah.
so there are internal wands that you can use as well.
Okay, that's an idea for someone who wants to
Yeah, I
buy the
Mhm.
know.
device. Will be it.
And I love that. I mean, I think for like a
Yeah.
postpartum population, that would be amazing. For a
Yeah.
menopausal population, that would be
Right.
amazing. I mean, I think there's a lot of use cases where it's like if we can get the research to like say, hey, these are great things to use, I would love
Mhm.
that. I mean, I think we're always looking for ways to help people. And I don't think
Yeah.
that exercise is the only thing. I'm always like,
Mhm.
PT is like one piece of the puzzle. We need, again, good hygiene, muscle
Mhm.
care, proactive tips. It can be
Mhm.
medications, it can be devices. So and that recipe is different for everybody. So what
Mhm.
I love are options for people. And that's where I really think that we can say like, how do we best optimize your pelvic care with like the options that we have?
Yeah, no, so cool. I feel like, there's like the term like vaginal, like rejuvenation. I feel like
Yep,
this mask would kind of really fit that. Because I feel like as we age too, like the skin gets thinner and you're more prone to like bleeding with intercourse, or just say it's itchy, more dry, especially around menopause. So I can definitely imagine this being very popular, maybe amongst like the perimenopausal or menopausal population, even aside from
totally.
like the wound healing benefits like postpartum. Yeah, so
Well, it's
that's so
interesting
fascinating.
too, because, topic, like we're kind of, there's so much buzz about perimenopause and menopause, which I
Mhm,
love
Mhm.
being someone who's
Mhm.
entering perimenopause or already in it.
Mhm.
And I think that, again, it's one of those things where we're really trying to have to push the system to be more proactive. Like,
Yeah.
does your vagina need to shrivel up and dry and bleed and have pain with sex until you get vaginal estrogen? Or can we just start giving people that a little bit sooner so they don't have to get to that point? And I think it's really kind of pushing the system forward to be like, how do we care for women proactively instead of
Mhm.
feeling like we're waiting till there's a problem and then we're trying to like,
Yeah.
backtrack.
Right.
So I'm a huge fan of vaginal estrogen, huge, huge, huge. I think it's really beneficial for people. And, we get one pelvic floor and we need it to last like 70, 80, 90 years. So like we got to pull in those puzzle pieces to
Mhm.
really care for it.
I think the people want to know, when should you start using topical or vaginal estrogen?
Mhm.
So, this is something, and again, I'm not a gynecologist, so I think some gynecologists would have different opinions. And again, within gynecologists, there's so many differences. Like, there's a physician here locally that was like, we want to do as little as possible for as long
Mhm.
as possible. It's like, well, that is not the ethos that I live by. I'm
Mhm,
like,
mhm.
give me the cream.
Yeah.
So I definitely think when you're perimenopausal, I'm a huge fan of proactively starting to use topical estrogen. And you start to feel those changes of dryness, needing more lubrication during intercourse. You may start getting more frequent urinary tract infections. You may start having a little more leaks like, oh, I didn't used to leak when I cough and now I do. So that's when you start seeing those changes within the muscle tone, the tissue integrity, and that's where the estrogen comes in to really build up the tissues in the vulva and vagina. And this is also where it comes to like you got to look at your stuff, because if your labia start to thin and resorb, and or the color starts to change, it gets whitish and it's not as pink, then you're like, okay, those are signs of low estrogen as well. So I would say start looking at your vulva, start looking out for signs as you get into like your late 30s, early 40s. And then I would start having conversations with your medical provider about using topical estrogen. Another time is postpartum. The research is saying that it doesn't affect milk supply if you're breastfeeding, but I also say like do what works for you. I didn't do it when I was breastfeeding, but I did afterwards because there was so much kind of de-estrogenation in the area after lactation. So that's another time that people can respond to this. And then in menopause, like till death do you part, like forever. Use it on your vulva and vagina, and it's like brushing your teeth. You just gotta do it.
And I think people are using it, and there's more and more studies coming out for topical estrogen for your skin too. So I've talked to
I want to
several.
hear what y'all think about that.
Yeah,
I've
I'm
spoken
definitely
with
pro that.
Yeah, I've spoken with a few doctors, a few dermatologists prominent in the field who are big advocates for topical estrogen. What do you recommend it, Mamina or Jenny? What do you tell patients?
I don't recommend it like as a blanket, product for everyone, but it's something that I will bring up in people who are postmenopausal. And if they're already doing all the other things for their skin that I recommend, like retinoid, antioxidant, sunscreen, moisturization, and they're looking for something more, that is something that I will bring up, and I'll prescribe it with the compounding pharmacy.
Yeah,
I use
I have
estradiol.
Yeah, I'm very similar to Mamina. It's not the first thing I recommend, but I am hearing so much more and more about it. And I have a gynecology friends who literally would just put it on their face,
So you just take the
and
vaginal
swear.
one and you use the same one for your
Yeah.
face.
Essentially, she compounds it like Mamina probably does, like the same way, and then puts it on. Yeah, and it helps with the dryness,
Yeah.
especially around peri and menopausal skin.
I think it helps
So
with elasticity, and I've even
yeah.
heard it helps with pigment production, that it just overall gives you a glowier look to your skin.
Yeah. And I know
There
some derms
Mhm.
say, like, be careful if you have melasma. And, like, I tried to actually look into this and I couldn't find literature. I don't know if you guys found anything about it potentially worsening melasma. I think in theory you worry about that, but I'm not sure if it's actually shown to actually flare melasma.
Not
Um,
topically.
yeah.
I don't think
Yeah.
there's enough, because I think it's
Right.
gonna be more of like a systemic absorption
Right. Right.
situation, for
Hmm.
that. But yeah,
Yeah.
I know that is a topic that people bring up.
Yeah.
Yeah, and there's these menopause platforms now, or perimenopause, like online virtual consult platforms, which I've actually done before myself. And they kind of sell some of their own skincare products, and one of them is estrogen for the face, like topical application. So it's interesting to hear kind of what y'all. I mean, Mamina, I go to you first. What does she
I get
say?
it.
Oh, yeah, it's
Yeah. I was really surprised to learn that, like, or menopausal, like a lot of the problems, like UTIs, and muscle weakness is due to the lack of estrogen. And where the creams actually help with that is like reducing the infection part of it. So
Yeah.
that's so fascinating to
Well,
me. Yeah.
we think about it like the mucosa gets thin and
Yeah.
dry, and then it's more prone to tearing, and you don't have as much
Hmm.
support either. So it's like
Hmm.
everything just kind of starts to slide. And
Yeah.
so you also have decreased testosterone when we're aging. And so the testosterone is really what really helps build up the muscle tone and bulk. So it's like the tissues are weak, the muscles are weak, the microbiome changes because of the changes in hormones. So that's why I'm like, you want to be on the front side of it, but yeah,
Yeah.
frequent urination, chronic urinary tract infections, chronic bacterial infections, vaginal stenosis, even where it's like the vagina starts to kind of close in and it gets like tight. All of these things are really due to estrogen and the elasticity and the collagen and the tissues change. So it was fascinating because when I was writing my book, I'm like diving deep into the research and I'm looking at all the stuff. I'm like, oh, damn, we're kind of screwed, you know? Like,
Gosh,
let me
I
go keep
know.
applying this twice a week
gosh.
forever,
Yeah,
you
yeah,
know?
I love
Okay, so
it.
Dr. Sarah, I want to know because I'm probably like you, perimenopausal, we're getting there. Like, what are all the things you are doing for your pelvic floor health? So that way I need to do the same. So I'm going to be ahead of the game when I
love this,
actually
Jenny.
reach menopause.
It's so funny because I'm with the book, it's like they tell you to give away all these freebies. And I was like, asked my community, I was like, what do y'all want? And one of them was like Sarah's top 10 tips of like what
Yeah.
she actually does for her pelvic floor.
Yes.
And that was
Yeah.
the most popular. I was like, okay. I use a squatty potty when I poop so that I don't strain.
Love
What?
it.
Okay. Well, you need to go. I want to hear all of this, but
Yeah.
you need to go into that a little bit more.
Yeah.
So the optimal position for pooping without straining is squatting. If we think about Asian countries, if we think about historically in, our society, if we think about being outdoors, it's you squat and it's because it relaxes a particular muscle in your pelvic floor that keeps in poop. So when you squat, it relaxes that muscle. So it like unkinks the hose so that poop can just come on out straight. Otherwise, you're trying to like get it around this like tricky angle and you end up straining and that can lead to hemorrhoids and prolapse. So using a squatty potty, which is like a little stool underneath your feet, and then it puts you in more of a squatting position so that when you go to have a poop, you can exhale, don't hold your breath, breathe out like you're blowing out a bunch of birthday candles and you're in that squatting position. So that's
Can
my
I
number one thing.
Sorry, can I just
Wow.
add to that? Like, so what, because we have squatty potties for all of our toilets, and when I go to hotels, I'll just take a trash can. Maybe I learned this from you. Like, turn it upside down and put my feet
No
on the trash
way.
can.
Oh, totally.
gosh.
Yeah.
100% sideways trash.
Wow.
And
Love
sadly,
it.
that's what I had to do in the hospital after I had my babies
God.
too, to like get that first baseball sized poop out. I was like, okay, give me that trash can because
Yeah.
none
So
of them have
basically
like a squatty potty.
sit on toilet, but like elevate your legs.
Elevate your feet. Yeah.
Feet.
So that your knees are higher and you're kind of in like a squatting position, but you're
Oh,
sitting on the
wow.
toilet. Yeah.
So, is
So,
a
and it's,
squatty potty make or break? What happens if I don't use one? Because I've never used one.
you're missing out on the best poops of your life, Lindsay.
Okay. Oh my
Yeah.
I
God,
don't know what to
Lindsay, you
say.
gotta get
Yeah.
on it.
All right, I'm about to have like life-changing shits after this, and
I
I'm
know.
here
Yeah.
for it.
Seriously.
Oh wow. Okay.
So I use a squatty potty. I don't power pee. So power peeing is like
What?
what so many of us like moms, medical professionals. I mean, we are notorious for this where we go to the bathroom and we try to pee as like fast as we can. So we push our pee out and that weakens your pelvic floor and it can actually lead to like incomplete bladder emptying because you end up tightening your muscles and then you're trying to push against that. So when you pee, you should not push. You should sit down instead of hovering, like line the toilet with toilet paper if you're not at home, and then lean forward and then just breathe. And as you breathe, your pelvic floor muscles relax and your bladder, that is actually a muscle, the detrusor muscle, which pushes the urine out for you. So don't power pee.
Oh my gosh,
And
you just blew my mind. I was just telling them earlier
Literally.
that like one of the problems for me postpartum is like I have a hard time emptying. I feel like I'll have a little bit more like retention after I pee, but probably because I always force my pee.
Right.
And then
as,
I have to, yeah. And, then I have
and
to
as
sit for a
medical
little bit
providers,
longer
y'all are
too.
probably so busy,
Yeah.
like in
Yeah.
between patients or navigating kiddos. So,
Oh my
and
gosh.
then in your case, Jenny, I would do what's called double voiding. So that like you sit down, chill,
Yeah.
pee, and then I tell people to like wipe, stand up again, and then sit down again and relax. And then see if more urine comes out. Because sometimes it
Wow.
can kind of reposition the bladder, or
Wow.
instead of pushing those last few drops out, I just recommend double voiding.
Oh,
Is
wow.
and
is it true that you shouldn't pee just to pee? I've heard from another pelvic floor therapist
Also.
that like, oh, hey, we're going on a long car trip. Everyone pee before you go. I heard you shouldn't do that.
Correct. It's called just in case peeing. And so what's normal to pee is every 2 to 4 hours. And so if you are peeing every 30 minutes, every hour, every time you get to Target, every time you leave Target, every time you leave your house, you're not training your bladder to expand fully. And when it expands, your bladder sends a signal to your brain that says like, hey, I'm getting full. I'm going to have to go soon. But if you never kind of get that signal and you're always just peeing just in case, then your bladder can actually shrink. And then it starts taking just a little bit of urine and your bladder's like, oh, I'm full. And then it goes. And then, oh, I'm full. And then it empties. So you really want to get to that 2 to 4 hour mark. If you're pregnant, it's going to be closer to 2 hours. If you're aging, it's going to be closer to 2 hours. But normally you should be able to go every 2 to 4 hours. I will say in the healthcare profession, we're notorious for like not peeing. We are notorious for like waiting 4, 6, 8 hours. I've done it myself many times because we're just so busy. So like take the break, go pee. If you overhold it, if you overstretch your bladder, that's also a problem.
Yeah.
And then the other thing, Jenny, is that I do pelvic floor training. Like I am
Yeah.
pretty religious now. And I started this I have a whole pelvic floor exercise program and I do the exercises. And even when my patients are in the clinic, when they're contracting, I'll be like contracting when I sit in my stool and just do it along with them. But I started doing much more consistent strength training about a year ago, like lifting weights. And when I do that, I do pelvic floor contractions with that. So like I'll Kegel and then do a squat, Kegel and then do a lunge, Kegel and then do a bicep curl. So I'm always with my fitness, like doing a pelvic floor contraction. And that over time just builds up your pelvic floor strength. And you're using resistance exercise to help. So I only do it once or twice a week, but it has I can feel my contractions getting stronger, holding for longer. So it's those are the things that I'm like, just these little things you can build in really go a long way.
Yeah, I love that because I feel like you're just incorporating that to your natural workout
Right.
eventually. I feel like in the beginning you kind of have to think about it consciously, but I feel like now probably flows naturally for you to like do that,
Totally.
right?
Yeah.
How long are your exercises when you are doing those like 3 times a week?
10 minutes.
Oh, okay.
Like if I do my own workout, I have a
Yeah.
trainer that I see once a week, and our workouts are like, I would say an hour, but like half of it's running and cardio and half of it's like strength training. But when I do my workout program that I have online, the Beehive, the workouts are 10 to 20 minutes. So they're 10 minutes just to start. And I built it when I was kind of earlier postpartum because I was like, what can I do as a mom where I don't have 30 minutes a day? I have 10 minutes. And then I also built it for like my mom in menopause and postmenopausal. I was like, she can't do a 30-minute workout. So they're all 10 minutes for, pregnancy, postpartum, perimenopause. And then people were like, hey, can you build longer workouts, Sarah? So now we're working on 20-minute workouts for people that are more resistance training with weights and bands and kind of a little more, as for myself, it's really a reflection of what I'm doing in my own life. And I find it to be really helpful to incorporate the pelvic floor exercises into it.
Do you also incorporate massage with that too?
So it's funny because I actually have a video on how to use the internal wand, but then I have a whole series on relaxation. So if you are a person who falls into that camp of tension, there are videos on how to use the internal wand, to do dilators, to do cupping, to do ball massage, and then to do more stretching or yoga type workouts at home that are more relaxation focused versus strengthening focused.
Sarah, I feel like I still have more questions, but I have the luxury of seeing you in person, so I can continue to
Oh, I
ask you,
love it,
but
yeah.
we're getting to the hour. So before we wrap up, is there one takeaway that you want people to have regarding their pelvic floor?
Ah,
I know that's hard.
I know, but I would say
whittle
to
it down to one.
be proactive about it. And I really
Yeah.
think that starts with learning. I think it starts with educating about like, oh, what does this part of my body do? And then how do I know if there's a problem like leakage or pain with sex or hemorrhoids? All of these things are really pelvic floor related and they're easy to address. And that you don't have to like deal with these problems. There really are solutions and things that can help. And that's what I really hope that the book does for people is really just kind of enlighten them about their bodies, that it is quite easy to take care of. And it does take consistency in training if there's an issue, but there's also support and help for them as well. So yeah, we get, like I said, we get one and let's take care of it.
Love
I'm
it.
so excited for your book, and I feel like there's so much information that we can still learn from you. And if someone wants to learn more, where can they go to find more information?
Well, I'm on social media as The Vagina Whisperer, so you can find me on Instagram or TikTok, and then my website is thevaginawhisperer.com, where you'll find more about my online workout program, and then pre-order my book as well. So thank you all so much for having me. This was such a fun
Yay.
conversation.
And for all of you guys listening, we have a free PDF guide sharing all the key takeaways from this episode. Head to the show notes for the link to get access now. And don't forget to click that follow button on Apple Podcasts and Spotify so you never miss an episode. Thank you, Dr. Sarah. You have been absolutely fantastic.
Thank you so much.
Thank you all.
Thank you.
This podcast is for informational and educational purposes only and is not a substitute for professional medical advice. The hosts are licensed dermatologists, but listening to this podcast does not create a doctor-patient relationship and is separate from their work as board-certified dermatologists. By listening to this podcast, you acknowledge and agree that the hosts and producers are not liable for the use of the information provided. Any reliance on the information is solely at your own risk. Always consult your own dermatologist or healthcare provider for advice specific to your needs. The hosts and producers are not responsible for any actions taken based on the information provided. If you have a medical emergency, seek immediate care from a healthcare professional or call emergency services.